Thank you. And good afternoon, everybody. First, I just want to thank AAPA, Katie Desmond and Caitlin Harrison for this opportunity. Myself and my co-hosts, we are just so excited to share this information with students and fellow PAs that are interested in the Commission Corps. So really appreciate your time as well, taking the time taking out the time out of your busy schedules to come and listen to our presentation. The presentation today is entitled USPHS Senior COSTEP, which is SRCOSTEP, Why Every Student Needs to Know This Alphabet Soup. And again, that spells out United States Public Health Service Senior Commission Officer Student Training Externship Program. And we are very excited. This is one of the opportunities that we have with PHS that is available to students, and we find that it's very valuable. Again, my name is Lieutenant Holland. I go by Sheree day to day. I'm very approachable. So, if you have any questions or want to reach out to me after this presentation, as well as my co-presenters, we are always available to answer questions. And we also will provide the Commission Corps headquarters information, their email and their phone number. So at this time, I would like to introduce my co-presenters, Lieutenant Chelsea Makowitz and Lieutenant J.G. Herman Herrera. Both are wonderful PAs, and we are really excited about this opportunity.
Hi, good afternoon.
Hello, thank you for joining us.
So the next slide, the purpose of our webinar is, in addition, we're going to provide an overview of what PHS is. We did see the questions that you had about what our service actually is. I know the majority of you have never heard of us. Some have heard of us and want to know more. And a very few of you actually do know what PHS is. But again, we are one of the 8 uniform services that are available. My colleague, Lieutenant Makowitz, will go over ways that you can apply to Senior COSTEP. And some of those ways that you can apply are also ways that you can apply to PHS if you have already graduated. And last, as a treat, Lieutenant J.G. Herrera is going to give you his personal story of how it was going through the Senior COSTEP program and how his experience has been as a Commissioned Corps officer. And what I want to point out is the person to the left in that photo is me getting pinned, shy of 5 years. So one of my personal goals of this webinar is to share this because I've been a PA for 16 years. And had I known about this opportunity sooner, I definitely would have jumped on it. So I'm really glad that you're on to actually get this ahead of the game. And if you have questions, we will answer those at the end. So to start, as an introduction, our motto is In Officio Salutis, which is in the service of health. We are the only branch of service that focuses on public health. We were established in January 4th, 1889. We fall under the Department of Health and Human Services, HHS, and are overseen by the Assistant Secretary for Health, or the ASH. Again, our day-to-day operations are under the United States Surgeon General, which is also known as the nation's doctor, and the Deputy Surgeon General. One of the other things I want to point out, if you saw Chelsea and Herman, they are wearing the uniform that you see at the top picture. That is our what we call ODUs. We wear the operational dress uniform that's blue and gold, which are our colors. And as you see the picture below with the former Surgeon General, Vice Admiral Jerome Adams, we also wear the Navy uniform, which is what I'm wearing. So we wear a uniform every day in our dedicated service. Now, I know you took time out of your busy schedules this afternoon, and I don't want to, bore you with a lot of history, but I find that it's very important to kind of know like how we came about. On July 16, 1798, the Act for the Relief of Sick and Disabled Seamen was signed by President John Adams at the time. This act actually stated that the sailors would pay 20 cents out of their paycheck to pay for their health care and also to help build these marine hospitals where they were being seen. So if you will, this was the first health insurance policy. And in that act, in 1870, the Marine Hospital Services were established, and that's where they were seen. The first Surgeon General, which was a supervising surgeon at the time, it was Dr. John Maynard Woodworth, and that was in 1871. I'm not going to go through all of these, but I just wanted to point out that before we, we were officially created in 1889, this is our history and how we came about. Another one that I wanted to point out was in 1878, this National Quarantine Act was signed at the time. And this act was basically the seamen were coming in from the ports and on the ships, and they were coming in with yellow fever. So one of the things that the surgeons and the physicians at the time were doing were going to meet these sailors at their ports and basically screen them to make sure that they weren't, that they didn't have yellow fever to spread to the general population. And this kind of stood out for me, because we did the COVID pandemic starting last year, and we had missions and deployments where we went out and screened folks at airports and on cruise ships. So very similar mission, even to this day. Again, 1889 is when we were created. Public health service at the time was strictly physicians. And later on in the presentation, you'll see that there's 11 categories. Physicians were only in the public health service at the time. So by 1930, the Parker Act expanded it to other disciplines. And the first one after that was engineers. And if I can go above that, 1912, again, the public health service was seeing the sailors and the military, but this was also at the time where they expanded to the general public. So again, very rich and robust history for us. And later on down the line, you can see that the Department of HHS was established in 1979, and we had our first disaster mission in 1999. So a lot of questions that you had were, who are we? A lot of you know, if I spill off the armed forces, the Army, Navy, Marines, Air Force, and the Coast Guard, you all are pretty much familiar with them. You might even know the Space Force, and I actually wrote some stats. There's 70,000 people in the Space Force. So, we're a really small branch of service, but it's about 6,500 of us currently. And again, we are the only one that serves the public and are dedicated to serve the public health of our nation. We also are dubbed the America's health responders because of that. And so I just wanted to point that caveat out that we're a little bit different. We don't fall under the Department of Defense, and we don't fall under the Department of Homeland Security like the others. NOAA is the other uniformed service that you might be familiar with, the National Oceanic and Atmospheric Administration, which PAs are, not just PAs, but PHS officers are also working there as well. Our mission and values are pretty simple and self-explanatory. Our mission is basically to protect, promote, and advance the health and safety of our nation. And we do that based on the core values. We take very good, great pride in being a very small branch of service, but we do express, leadership, service, making sure that we're compassionate in what we do, excellence, through our job performances, whether we are in our offices or on mission, and integrity, making sure that we put ourselves in an ethical manner, work in an ethical manner, and hold each other accountable. So great mission, great values. Another question that a lot of you had were, what do we do? So we do a lot of different things. We provide essential health services, both in a clinical setting and also a non-clinical setting. We have jobs that are in the city, but most of our jobs are providing care in the vulnerable and underserved population, which is our key population that we treat and serve. So the other things that we do, which I mentioned kind of like the deployments that we've done, is that we are on the front line of any public health emergencies, such as natural disasters, hurricanes, tornadoes, and we've even been to monsoons, disease outbreaks such as the COVID pandemic, and also the global health, public health emergencies and other humanitarian missions such as the Ebola years ago. I know that I've worked with some colleagues that actually got deployed to that into Liberia and were a part of that. So there are many opportunities to deploy. And I know that you had questions about that. We don't deploy to war. We only deploy to natural and public health emergencies. We also lead public health programs. So again, if you're wanting to do more than direct patient care, there are opportunities and agencies that we do work at that we can support public health programs and policy, and also advances in research in the areas that you see below, whether it's cancer research, COVID, and the opioid crisis. So the next two slides that I have here are discussing the benefits of service. So many of you had questions about, what kind of job opportunities do we have? What's the difference between us and the military, the traditional military? So we have, very similar benefits to the military as far as our pay and our housing and food allowances. One of the great things that I like about PHS is that there's so much diversity within our branch. You can work, and that's another difference between us and the other services, is we choose our own positions. The PHS, they encourage us to move around and to explore other opportunities. So you never feel like you're pigeonholed. And, if you're interested in advancing your career for promotion reasons and just for career growth itself, they certainly encourage that all the time. There are also training and educational opportunities. We get emails for fellowships and trainings. We also do, just different things that we can do for our professional development in order to promote, like I said, and also to show leadership. One of the other great things, which I'll move to the next slide, which shows a little bit better here. So let me go back to career growth. So I talked about professional development and leadership training, which is available. Each new officer receives a mentor. The mentor is usually within the category that you're in and a discipline. So when I first got in, I had a PA who worked for FDA, and he was wonderful to be, kind of holding my hand throughout the process. I was an Army brat. I have no military background, so it was very new to me. So having someone to kind of like give you guidance was really helpful. And even now as a lieutenant commander, I have three, again, for career growth. I have my same PA mentor. I also have a mentor in health administration and public health, because that's kind of like where I want to move my career into, is public health and health disparities. So you have that option to get a mentor. You can choose your mentor as well. Assignment mobility is, again, encouraged. There's many opportunities for us, and I think my next slide will show you where we actually work. And the GI Bill, which I don't know if Chelsea's going to get into this. I want to take too much from her slides, but you are eligible for the GI Bill after a 3-year service commitment. So you can keep it for yourself and use that towards your career, or you can also transfer it to your children, like I plan to do. As far as financial incentives, we have a very competitive comprehensive package. We get paid through the very similar to the military. So I know Chelsea will go over the pay scale with you. Again, we have housing and food allowances. Housing allowance is based on the cost of living and where you're going to work. The food allowance is based on whether you have dependents or not. So on top of your base pay, you do get these allowances. The other good thing as a mother now is that and even as a single person before, we have great healthcare benefits. We pay little to no money for our healthcare. For example, and I'm just giving personal stories here, my son has a very severe peanut allergy. And as you know, a lot of civilian contractor jobs, you have a deductible to make for your insurance. So when I first got the EpiPen, that I usually pay $300 per EpiPen for free. It was a very, even just having that is just outstanding. We have a thrift savings plan, which is very similar to a 401k style retirement, and life insurance and survivor benefits. And then again, work-life balance is always encouraged. It depends on your agency, how much work-life balance, and based on the flexibility of your position. But we do all get 30 days of paid leave. we get, and I'm gonna put air quotes, unlimited sick leave. So sick leave does not come out of your annual leave bank. We all get paid maternity and paternity leave, and also all federal holidays are paid. Again, a lot of questions we're asking, well, where do you guys work? All of us work all over, all 50 states. Here it says 800 locations, and there are several that have foreign assignments. So we work everywhere. There's positions open up, obviously, with HHS, which is CDC, CMS, the Center of Medicare Services, the FDA. HRSA is where I work here in Rockville, Maryland, but we have regional offices. Indian Health Service is a very huge agency that a lot of us work at. ICE, Immigration and Customs, and NIH and SAMHSA, which is the Substance Abuse and Mental Health Services Administration. So that is just all just from what the Department of HHS offers, but we're at the DoD, so obviously military is all over the country. Department of Homeland Security, working with US Marshals and the Coast Guard, the Agency for International Development, working with humanitarian missions. Federal Bureau of Prisons is where my colleagues Chelsea and Herman work, and other state governments and local agencies, National Park Services, just a lot of different areas that you will find us, USDA, and it's all on our website. Okay, my last two slides is just talking about the different categories. So I just wanted to point this out that we have 11 categories, but you guess where PAs are located? We are in the health services category. So I'm going to move to the next slide. Health services, we're considered health services officers, which are called HSOs. We are the third largest category, but the most diverse. And I was shocked to even know this myself, that there's 53 disciplines within our HSO category, but PAs are in that category. I'd like to highlight that, again, we said there's 6,500 active duty officers currently in PHS. Well, if you look at the number, there's roughly 170 of us in service right now in PHS. So we're in very high demand, which is one of the reasons why we wanted to do this webinar and promote this for anyone who's interested. There are clinical and non-clinical positions that are available. If you pass your PAN-RE and your PANTS, you do get a $500 a month board certification pay, if you show proof of your NCCPA. And another great incentive that we have is because we're in such high demand and we're always on what we call an open cycle, which means open application cycle, which means that we're always looking for PAs. Some categories actually close, but we're open. A retention bonus that we have is you can sign up to 4 years, and each year you'll receive $20,000 just for signing on and giving the commitment to the Corps. Certain agencies have college loan repayment, and I know some of the questions came in about that. So it just depends on what agency that you choose to find work. And then obviously the SRCOSTEP is why we're actually having this presentation today, which I know my colleagues will go over much more. The website for where the PA information is below on this slide. We are working on modifying that. And, again, if you have any questions about, joining or anything like that, we have all listed our information, as I mentioned, after each of our presentation. I am currently the chair for recruitment for our professional advisory group until the end of this year, but definitely feel free even in the future. Reach out to me at sholland@hrsa.gov, and I will be very happy to answer your questions. So I want to leave you with that. That's me on a mission. I did a border mission in Texas, and that's my beautiful mini golden doodle, Lola. So thank you so much for this time. And I'd like to pass this over to my colleague, Lieutenant Makowitz.
Okay. Hello, thank you all for coming. What I'm going to focus on mostly is kind of how to become a PHS officer. So Lieutenant Commander Holland talked about kind of what the PHS is, some of the benefits that you get, where we work. So the question then is, how do you become a part of it? So next slide. So there are some basic qualifications. The U.S. Public Health Service is a uniform service, and you do get the almost exactly the same benefits as you would in any other uniform service. So the same benefits that the Army, Navy, Coast Guard, Marines, all of them have. You are considered active duty, and you wear a uniform to work every day, whether it be the dress blues, the khakis, or operational dress uniform. So you do have to be a U.S. citizen. You should be less than 44 years of age. There are some waivers for up to age 50. The idea with that is that you complete your 20 years of service before you hit retirement age. There is a pension at the end of the 20 years, and you can serve for up to 30 years. At 30 years, unless you're incredibly special in the Corps, they do kick you out of the Corps. There is a medical and a physical review. There is a medical certification that you have to go through. There are some chronic conditions that disqualify you for service. Physically, you have to meet certain BMI standards. It's a BMI of less than 27, so a little less strict than our DoD counterparts. But it is the Public Health Service, so we expect our officers to be healthy as well. You do have to pass a suitability review. There's a interview panel with, I believe it's 5 or 6 other officers with just generalized questions about service and all of that. There is a background check that you have to pass because depending on your position and where you work, you may have a relatively high security clearance. You need a qualifying degree from an accredited institution. So anybody who's going to PA school in the US, you're already working on that, or if you've graduated already, congratulations, and you already have that degree. And then as a PA, you should have a current unrestricted and valid license to practice in one of the 50 states. So because you're working for the federal government, for myself, I have a license in Massachusetts because the prison that I work in is in Massachusetts. But when I deploy to other states, that state license kind of carries with me for the most part, and I fall under federal service. So yes, next slide, please. So if you are currently a student or about to be a student, there is a wonderful student opportunity called the SRCOSTEP program. That stands for Senior Commissioned Officer Student Training and Externship Program. I went through this program I started the application in November of 2013 and finished it in, I started it in November of 2014 and finished it in August of 2015 when I officially commissioned with the USPHS. So it is a long application process, totally worth it at the end of it though. It's recommended for students who are in their first didactic year. This typically opens up in the summer. So we finished up this application period for this year back in July or August. It opened up in June and was open till I believe the end of July. So if you are going into your second didactic or your second year of PA school, you've kind of missed the boat on this opportunity, but anybody who's pre-PA or in their first year or just starting, this is something to look out for if you're interested in serving with the Public Health Service. You become a commissioned officer on ready reserve status while you're completing your PA program. So while you're in your program, you can't get deployed. You're not going to any you're not going to any federal job. You're getting paid to finish your school. You don't have to wear a uniform when you're finishing your program. While you're in school, you get paid an O1 salary, and we'll go over kind of the pay scale in one of the next slides. And you start receiving active duty benefits for up to 10 months of school as you complete your program. I'm sorry, up to 12 months of school as you complete your program. So those active duty benefits include the TRICARE Prime, the free health insurance. You are accruing annual leave days. You're getting your basic allowance for housing in addition to your base salary. And you're putting in time towards your active duty service. You're guaranteed a job at your sponsoring agency upon graduation. This year, the sponsoring agencies were the Bureau of Prisons and ICE Health Service Corps, so immigration. Every once in a while, Indian Health Service. I've seen NIH once sponsor students, but for the most part, it's the Bureau of Prisons and immigration that are looking for people because they are very high need populations. If you get accepted to this program, you graduate, you get your license, you work at your sponsoring agency, you're obligated to serve the Commissioned Corps for 2 years, or twice the amount of time you receive your benefit. It ends up being 2 years. At the end of the 2 years, you can either stay where you are, you can move to a different spot within the agency that you're in, you can move to a different agency, or you can leave. For myself, I absolutely loved what I was doing, and so I decided to stay both at the agency that I was assigned to and with the public health service. Next slide. So here's that military pay scale. So when we say 01, that is kind of the first officer rank. It's designated as an ensign. We follow Navy rank. So it goes ensign, lieutenant, junior grade, lieutenant, lieutenant commander, commander, captain, and then up into the admiral ranks. So what you notice is kind of your base pay. And this is only a portion of your total paycheck. So if you're an 01 with 2 years or less, so when you come into the senior COSTEP program, your base pay would be around $3,400 a month. In addition to that, you also get your basic allowance for housing, which is another usually $2,000 to $3,000, depending on where you are in the country. And on top of that, you also get a basic allowance for subsistence. When you graduate is when you start getting board certified pay. So after you pass your NCCPA and get your state license, you're eligible for board certified pay, which is an additional $500 a month. If you are a senior COSTEP, after your payback time, you can sign up for a retention bonus. They come in 1, 2, 3, or 4 year amounts. If it's 1 year, it's $5,000 a year. 2 years is $10,000 a year. 3 is $15,000. 4 is $20,000 a year. So that's a nice extra thing to have. When you graduate and get your license, you convert over to a lieutenant junior grade, which is an 02. So your pay immediately goes up there. And then after a couple of years, you're eligible to promote to 03 and so on and so forth. For myself, when I first graduated, my total pay was probably a little less than most of my graduating cohort, just for that time. But that doesn't include the benefit of free healthcare, not having to pay for malpractice insurance, and having a job straight out of school. I didn't have to look for a job out of school. They said, you're going to go here. I was like, okay, good. I don't have to worry about that. So while my classmates were worrying about interviewing and trying to get a job, I had a job within a couple weeks after graduating. It was already getting paid while I was in school, which was a huge stress off. Now, 4.5 years out from graduating, I probably make at least as much as my coworkers or my cohort, and I will make more in my career than they will because it's not capped by my profession. My pay is based on my rank and time in service, not my profession. Plus those retention bonuses certainly don't hurt. So it is a fairly competitive pay scale when you add everything together. It's not just the base pay, it's also basic allowance for housing and everything else that you get. If you are prior service, your years of prior service do count towards your pay. So say you were Army beforehand for 3 or 4 years, when you come in, you would be an 01 with that many years of service, if that makes sense. Next slide. So the application process. So the application typically opens in June, July. So anybody who is starting school now or will be starting later this year should kind of start to prepare to apply this summer. The best time to apply is in your didactic year, that first year of school. The application period does take a long time. It is worth it. And there's a whole committee that helps you do that. The application process includes a security clearance. They do look at your credit. There's some agency specific material and a medical exam. There's a phone interview with commission officers from different areas, and kind of some agency specific stuff. So like for Bureau of Prisons, there was a little bit of an expanded background check compared to the one for Public Health Service. And some of the agencies that have COSTEP students are, BOP, IHS, and Immigration. Next slide. So like I said, there is a senior COSTEP committee that helps you through the process if you decide to apply through the COSTEP process. We work primarily with the Bureau of Prisons, as this area is a very high need. I've worked for the Bureau of Prisons for 4.5 years. Anybody who's worried about safety or anything like that, I do wear a stab vest to work. I do carry OC spray. I have never needed either. Most of the patients are incredibly grateful. It is an incredibly high need, high risk population. And there's never really been a time where I haven't felt safe at work, where I work. Most of the time, they are very grateful to get any kind of medical treatment. And it's very rewarding working with a population that is such high need. As I said, the application process is lengthy, but there is a team available to help along the way. And those are just some pictures from PA school from myself, surgical rotation. Who knew masks would come into style? Next slide. All right, so if you're hearing about this and you're like, I really wish I had been able to apply to COSTEP, you're still able to apply after graduation. So in order to apply for U.S. Public Health Service outside of that student opportunity, you have to apply for a federal civilian job on usajobs.gov at one of the civilian agencies that are staffed by Public Health Service. So Bureau of Prisons, Indian Health Service, National Institutes of Health, CMS, FDA, immigration, all of those agencies employ U.S. Public Health Service officers. The VA also does as well, but we're just sort of getting a foothold in there. During open application periods, which right now for PAs, it's always, you can apply to transition from your civilian job to a commissioned corps officer. So you work with your Human Resources Department to do that. And all federal agencies post positions online around the country at that usajobs.gov. It's a great resource. Whether you want to go PHS or not, it's a great job resource for people who are looking to find a new career path. Next. So just a little bit about my story. I joined the Public Health Service through the Senior COSTEP program while attending the University of Bridgeport's PA program in Connecticut. Towards the end of my PA program, they send out a list of institutions that would be willing to take a new PA. I chose FMC Devens, which is one of the federal medical centers within the BOP. So the Bureau of Prisons has 6 now medical centers that have higher risk and more complex inmates. So our patients include people with CHF, COPD, kidney disease. We have a 100-bed dialysis center. We have a transplant program. We have patients who are suffering from cancer, all sorts of different things. I've seen more there than I think I ever would have seen in a civilian role. When I first started, I was working as part of a primary care team that was almost a mix of internal medicine and primary care, and recently transitioned to the transplant coordinator role. I have been able to obtain a CAQ in nephrology, just based on the patient population that I've been working with. We have a lot of high blood pressure, diabetes, and CKD. And we have nephrologists who we work with directly as well with that population. So it's been a really, really interesting career choice for me to work with the BOP. It's been really neat. As a commissioned corps officer, I've had the opportunity to deploy 7 times, and that's mostly by choice. I chose to join a rapid deployment force team when I first started. The picture on the side is actually down at probably the same border station that Lieutenant Commander Holland was at, just at a different time than when she was there. So I've gone for 2 hurricane responses, Hurricane Maria in Puerto Rico, where I got to change a trach in the middle of a basketball stadium. None of my graduating class has done that. And Hurricane Florence in North Carolina. Been to the border twice for medical screenings. I went to 1 COVID response as part of a PHS response and 1 COVID response helping out another BOP institution. And my most recent deployment was to provide medical care for a high profile inmate at one of the BOP institutions, which was interesting. So there are a lot of really cool opportunities for PHS officers, whether it's your duty station or deployment opportunities or training opportunities. One of those COVID missions was actually as part of an aeromedical evacuation team. So that training PHS provided for me. So I've gotten to do a lot of things that my fellow graduates haven't been able to do. It's really, really kind of cool. Next slide. So that's kind of my spiel. There's me on an airplane treating COVID patients and at AET training because they actually let us treat patients on a plane. If you have any questions at all, whether it be about PA school, graduating PANTS, PHS, working for the federal government, please feel free to email me. I'm always happy to help. Recruitment is one of my passions. Public health service has been like the best thing that ever happened to me. And it's something that I really hope everyone else takes the time to consider because it is a really, really cool career opportunity for PAs especially. Thank you very much.
Great, thanks, Chelsea. Okay, now Lieutenant J.G. Herrera is next.
Oh, all right. Next slide, please. All right. Hi, good afternoon. This is Lieutenant J.G. Herrera. I'm a recently graduated senior COSTEP PA and I'm also assigned to duty with the Bureau of Prisons. I actually just graduated in May of 2020, so I'm pretty new, but I've had a pretty interesting experience already. And I'm going to be speaking about my journey through the senior COSTEP and coming into the BOP. So having the honor to be a senior COSTEP during my final year PA school reassured me that I would be able to pursue my goals of serving and providing healthcare to underserved populations and practicing disaster medicine. So as Lieutenant Makowitz spoke about earlier, it provides us financial security. During my senior year, I was paid as an active duty uniform services officer, and depending on where you're stationed or where your school is at, that's about $65,000 when you add everything up. Also, I had access to the innumerable benefits of being an officer in the uniform services, like TRICARE, having access to military bases and all the amenities that they provide, and also other benefits like the Service Member Civil Relief Act, which will lower your interest rates. And I think something that was really great was having a guaranteed position after graduation. It created a seamless transition into my career, and I didn't have the stress of job hunting and was able to focus on studying for the PANCE and getting the most out of my rotations. Also, particularly during the COVID pandemic, it was a great advantage to have a guaranteed position. And as Lieutenant Makowitz spoke about earlier, I did have the opportunity to interview with the BOP as part of the commissioning process, and you also have the ability to make a list of preferred duty stations and also to speak with APPs who work there. And finally, to ensure the success of the new senior COSTEP graduates, which may be a concern to a student, when a duty station is selected by the appointment committee for a senior COSTEP, they make sure that there will be appropriate support and mentorship at the station that you're assigned to. So that's really great for bringing you into your professional career. Next slide, please. So the application process, it's a multifaceted process which takes almost a year, but the senior COSTEP recruitment team is very supportive, and they're always there along the way to make sure that you're on track. We actually have weekly meetings where we discuss where we are in the process, and we also help each other out amongst the students. But I think persevering through the application process demonstrates an important commitment to wanting to join the Corps. And it's worth the effort because this allows you to transition into an organization that's going to ensure that you have professional development and countless opportunities for advancement throughout your career. As far as the commitment during the application process, some weeks you spend more time, others a lot less, but I would say on average it's about 2 hours a week of attending to matters pertaining to the senior COSTEP duties. During the first year, it pertains to getting your application commissioning packet ready. And after you receive your commission during your second year, which is your rotations, it's mostly about getting ready to transition into being an active duty officer and going to your base station. Next slide, please. So as far as being a PHSPA working in the BOP, I'm currently stationed in sunny Florida at Coleman Federal Corrections Complex. I work at one of the institutions within the complex, and it's actually staffed by an MD and 2 PAs, including myself and nursing staff, of course. The PAs, we see the sick call and follow up on patients with acute conditions that we see during sick call, while the MD sees the chronic care patients. However, the 2 PAs there, we're still involved in the chronic care because we see patients between their annual or biannual chronic care visits and make adjustments to their management as needed. As a new graduate, I have a great support system from the MD and a senior clinical PA who is also a PHS officer. So they provide me mentorship to develop my clinical skills and also to develop my career as a PHS officer. They're always available to me, usually maybe 90% of the time in person. Because we work similar hours together, but also over the phone. We always have an attending physician. So a typical day, next slide, please. So a typical day working in the BOP, my day usually starts around 7:30 a.m. I come into my office, I answer emails and usually regarding medical trips for inmates, and I also review all the lab results. I have my own office, which also serves as an examination room, so it's pretty nice being a new PA in particular. I'm also the COVID-19 positive isolation advanced practice provider at the institution. So usually when we have COVID positive inmates, I go to our designated isolation unit and perform daily evaluations on the inmates in that unit and make sure they're doing well, or if they need escalation of therapy or they need just a PRN meds, I take care of those things. And after I complete those rounds, I return to my office and start seeing my sick call patients until around noon. After I take lunch at that time, and in the afternoon, I see more of my sick call patients. And since we pretty much provide all the primary care there, it's a big role. I also do small procedures. So we do intra-articular injections, epidermal cyst excisions, biopsies, and that sort of thing. And I usually complete my day around 4 p.m. and the patient load that we have at the institution, even though it's about 800 inmates, I'm able to complete all of my duties and my notes by 4 p.m. So I usually go home and I don't have to take work home with me, which is awesome. I know that's not the case for many in private practice. So the schedule creates a great work-life balance that I'm grateful for. Though that is a typical day, a lot of cases, the days are not typical at the Bureau of Prisons. On many occasions, I evaluate inmates with acute injuries or complaints, such as chest pain, etc. This actually creates a rewarding work environment for me because I have the ability to provide care for a wide assortment of medical conditions. I may be seeing an inmate for a chronic sinusitis follow-up 1 minute, and then an alarm goes off, and I have to evaluate an inmate with acute head trauma or a laceration. So it's I greatly enjoy the variety and the changes of pace that this provides. Oh, next slide, please. As far as commissioning into the public health service, I recommend applying for a commission through senior COSTEP to PA students, or to join in the public health service outright to PAs who are already practicing. To anyone who's interested in serving our nation by delivering healthcare, in particular in times of need, and right now is a great time to join, I think, with COVID, and who want to develop into leaders who will promote and advance healthcare in our country and beyond. I think commissioning into the public health service will lay the foundation for any PA to develop a rewarding career full of growth and opportunities to have a large-scale impact on health. And as it was mentioned earlier, we don't have that many PAs in the public health service, but I think there's a lot of opportunities for us to grow the PA workforce in the public health service, because I'm a PA, so I think we're so well prepared to be in both clinical and administrative roles, such as Lieutenant Commander Holland is in now. So I hope you truly consider this a great opportunity. Thank you.
Great. So now we're going to move into some of your Q&A. We have a lot of open Q&A questions, and some of them are very, very specific. So the best I can, I will try to sort of group like questions together, and I do encourage you to follow up with the U.S. Public Health Service team if your specific question doesn't get answered. So to start, do PAs work outside of the clinical settings, such as in the theater or field, for any of the associated agencies, DOD, U.S. Coast Guard, et cetera? I think you did mention that in a couple of slides, but can you address that one?
Yes, so there are PHS officers who work with the DOD and Coast Guard. And I didn't say exactly where my background was. I actually worked for the DOD. That was my first duty station at Walter Reed Bethesda. So I did have the opportunity to work with joint service base. So I work with all Army, Navy, Air Force, and Marines there. I worked in neurology and also with concussion care. So and again, they're all over the country, so there are opportunities for that. Thank you.
And you mentioned that there are some health requirements. Would something like a back injury prohibit service?
It depends on if it limits the person's ability to function. So that's something that would have to be reviewed with that person's primary care provider.
Is this opportunity available to permanent residents, or do you need to be a US citizen?
You have to be a US citizen.
Okay. And if one were to pick a billet with the DoD, would the opportunity be available to deploy at an overseas base?
Most of the time, the DoD positions are only stateside. I can get back to that person about that. I don't know of any PHS officers that work DoD from my experience that actually did overseas missions, like with going to war. So I'll double check that. If I can flag that one, I can get the answer for that person.
And in general, how much choice do you have over where you work geographically? Are you deployed to, do you have to go to where they send you?
So I know I'll let Herman and Chelsea answer for Senior Co-Step, but for folks who are like me, who I didn't go through Senior Co-Step, I started as a PA, graduating PA. You actually can choose your position. So I'm in the state of Maryland, so I wanted to stay close to home, just to start out as my first duty station. So within in this area, there's NIH, there's Walter Reed Bethesda, HRSA is where I'm at right now, Indian Health Service, and more. So you can choose where you want to work. They do not choose initially where you work. Senior Co-Step may have another requirement. And I'll defer that to you, Chelsea or Herman.
With Senior Co-Step, you are limited by the agency that is sponsoring you, so that's paying for you while you're in school. When I'll let Herman kind of go over this too, but when I was in the Co-Step program, they gave you a list of institutions that were looking for new PAs, and you ranked 1 through 5. Most people got their first choice.
Yeah, I will just add that I also got my first choice, so that was not an issue.
Can you provide a few examples of clinical and non-clinical sites that officers can be assigned to as duty station? And can they stay at their current civilian job as an officer?
So I can answer that. So as I mentioned, we have many agencies under Health and Human Services, CDC, FDA, like I said, SAMHSA. Those are more like in the non-clinical settings. NIH, you can do research and clinical work as well. So I know there's different opportunities at that agency. DOD, the same. I've worked both clinically and non-clinically at DOD. So it just depends. Depends on what's available, what that job position is. But there are different, it just depends on the job. So I believe different agencies have either or clinical or non-clinical, and some have more non-clinical, like HRSA or SAMHSA, like that.
How hard is it to transfer between different departments once you get up and going?
Transfer between different agencies?
Mm-hmm.
Is that what they're asking?
Yes.
From my personal experience, and I can defer to Chelsea and Herman if they're interested in responding to. Like I said, I transferred from DOD to HRSA without any issues. I know that they would like to, very similar to civilian jobs, some notice between the two, and you can transfer that way. Like I had to give a 60-day notice between my two positions. That's usually a problem.
We do have our PA professional advisory group that meets monthly, and we tend to review like any open positions with different agencies. So it makes it a little bit easier for PAs to kind of know what's out there, what opportunities are out there, and get in touch with someone to help with the application process for someone who's looking to make a move.
Does the USPHS qualify for loan forgiveness for those that are still paying loans post-graduation?
I mean, I know that we are eligible for the public health loan forgiveness program. I signed up for that, so I don't have much more of my student loans. Again, I didn't go through SRCOSTEP. So you do have to, you can apply for that. I did apply for that, and you have to pay your student loans for 10 years. So we are eligible for that student loan repayment, if that's what you're referring to.
I would assume that's what they're referring to.
Indian Health Service, I think, also does some loan repayment. BOP might as well. I know they do on the civilian side. I didn't personally ever look into that because it was COSTEP and wasn't eligible, but if you're not a COSTEP, you may be eligible for some of that loan forgiveness as well.
And I believe if you're a co-step after you finish your original commitment, you can also take advantage of the National Health Service Corps repayment. And that is actually just based on where you're stationed and if it's a high enough need to be able to qualify for that program.
When talking about health benefits, does the health benefits also include spousal benefits and dependent benefits? And is this TRICARE through Veteran Affairs and military hospitals?
That's correct. It is for your spouse and for your dependents. It depends also on your location. Most of the time you can get care, and if there's a military base that's readily available in your area. If it's not, in your area, you can get care at civilian, with civilian providers. I've actually had, if there's a certain, I guess, appointment, like I had an appointment for my son, then we couldn't find someone on base to do it. We were able to get care at Johns Hopkins or other civilian locations. So, and you just get a referral through TRICARE.
How do the contract offers differ from in-PA school receiving assistance to opposed to having graduated? So I'm assuming they mean for the folks to apply after they graduate versus going through the COSTEP program. Are there differences in pay offers or?
So I think we addressed some of this. If you join through the senior COSTEP, you're going to be sponsored by an agency while you're a senior COSTEP, and you'll be provided a job with them. So I was sponsored by the Bureau of Prisons, so they gave me a position to work in a prison when I graduated. If you apply out of school as a graduate, as Lieutenant Makowitz mentioned, you have to find a position, or the best way to do it is to find a position through USA Jobs in one of the agencies that we have officers at, and then you can start a public health service application to commission. And if you join after, say you're a graduate and you join after finding a job, not through senior COSTEP, you qualify for a accession bonus, or that she mentioned. And I think it's actually a little different between when you renew your contract, you get the $20,000 for 4 years. And I think there's a different one when you commission outright, there's an accession bonus, I believe.
Yes.
Does prior military service have a beneficial effect on your application or commissioning status? And additionally, this individual is going to use their post 9/11 GI Bill to pay for PA school, which starts in a few months. Would they be eligible for another GI Bill again through the USPHS after the required service time, or is that a benefit that would no longer apply?
I think the post 9/11 GI Bill is a one and done. So if you've used it based on your service in another uniform service, you don't get it again.
This is something I know was answered in the presentation, but just in case folks missed it, this person is a non-traditional student in their 30s. Is there an age limit for applying to the program?
As long as you're under 44 years old, you're good to go.
If someone is aware of another program called the Junior COSTEP program, what is the difference between Junior COSTEP and Senior COSTEP?
I believe junior COSTEP is for undergraduate studies, and senior COSTEP is for graduate students. So all PA students, we would be senior COSTEP.
For those that are prior military, is it only years of service that transfer over, or is there a pay adjustment for those with prior military medical experience?
I think it's just years of service, because whatever your medical experience was before, so like if you were a medic in the Army and now you're going to be a PA in the US Public Health Service, you have a more advanced degree, and your special pays will be based on your PA versus your medic or whatever other experience that you had.
There is one person asking where the cutoff is in terms of the application for senior COSTEP. They will graduate in May 2022. So they would still have 9 months before graduation. Would they be eligible to apply? Or is it really before they go into clinical year?
That might be cutting it tight. I did work with a nurse who applied to the senior COSTEP program and only got sponsored in her program for like a month or two. So she could certainly, when the application opens, that person could certainly apply. They just might be cutting it a little tight and may only get a month or two of benefits before graduating and starting their career.
Katie, can I go back to the previous question about time and service?
Sure.
So just from my experience, like I said, I came in a lot later than others. If you have, and I've only had PA experience, but if you have other medical experience, as long as it's within one of the categories that PHS has, they will take that into account. I've had other friends who had like lab experience or other experience that they actually did add that into their time and service, but you are capped at 9 years, just to let you know that.
And I think you touched on some of this in the presentation, but I think this is a sort of an interesting topic to explore. Is the work within USPHS for PA primarily primary care, or are there opportunities for surgery, intensive care, specialty positions?
It's opportunities for all different. Majority maybe primary care, but like Chelsea's nephrology, I believe, yes, and I was neuro, so there are different opportunities. I did neuro and sports medicine and concussion care, so majority will probably be primary care, but there are opportunities for other specialty care.
Do you have, and we're right at 4 o'clock, I think this is a good question to end on, and hopefully folks can send you their follow-up questions if we didn't get to your question. But do you have tips for applying to the program, how to make your application stand out?
Well, I would say you're gonna write. I recently went through this, so I would say write a good personal statement. Have a good CV prepared, and also get some good references that can really speak about you on a personal level and give you a strong endorsement. And the application process will, at least for senior COSTEP, will start around June, and you'll call to an original call, which will screen you and we'll make sure that you don't have any medical disqualifying conditions out like right in the beginning. And after that, you'll start the application process, and you'll be put in contact with the senior COSTEP recruitment team, which they're extremely supportive and will help you along the kind of long and a little bit arduous process that it is, but they're going to guide you through it. But those would be my my recommendations.
Thank you. I think that's really helpful. And I'd like to thank all of our speakers today for a really enlightening presentation. And thank you all for joining us today for this PA Like a Pro webinar series. Please check the PA Like a Pro webinar landing page for recordings of past sessions. You'll be able to grab a copy of this presentation and the recording probably by mid next week. And of course, sign up and look out for future events. Thank you so much and have a great afternoon.
Thank you.
Thanks.
Thank you.